you arrive at the South Downs Health and Care Primary Care Hub, you will drive into the lay-by or into the car park at the back, and you will be advised to either wait in your car until a clinician is ready who will call you, or be advised to go to the door. Once you've entered the building, you'll be directed to clean your hands. And you'll be asked to put on a mask. You will then be reminded to stay 2 meters away from any other clinician at any time unless directed otherwise, and asked to walk through the entrance and to the clinical area. You'll be directed through the waiting room to the clinical room that you've been assigned and asked to take a seat. At this point, please wait to be instructed further on your consultation. If you've been asked to use the medic spot by our clinician, you will need to enter your first name, last name, date of birth and postcode, and then you click continue. During your consultation, if we are using medic spot, you may be asked to do one, more or all of the following. The clinician might ask you to pick up the stethoscope and ask you to place this under your clothing in particular areas around your chest. There will be a video on the screen to assist you and direct you in terms of where to place this stethoscope. You may also be asked to use the torch. If the clinician feels they need to look into your throat, they will ask you to remove your mask. They will then ask you to place the instrument just outside of your mouth and not in your mouth, and to open your mouth widely. You will be able to see the back of your throat on your screen, as well as the clinician being able to see this. The clinician may ask you to use the same instrument to look in your ears. There will be an earpiece which you can attach to the end of the light. They will then ask you to hold your ear back with your other hand if you can, and place this instrument into your ear so that they can have a look inside your ear. Please leave the earpiece on the tissue that's available on the table, and put the light piece back in to the medic spot. You might then be asked to use the oximeter, which measures your oxygen level. To do this, the clinician will ask you to place your index finger fully into the instrument shown and to push the button should it be turned off. It can take a few seconds for the readings to come up, and either the clinician will ask you to read these out, or they will be able to see it on their screen. You might be asked to measure your temperature. This will be done via a forehead thermometer, where you push the on button, hold it a little bit away from your forehead, and you push the blue button again to take the reading. The clinician will ask you to read out the reading on the thermometer. Finally, you may be asked to take your blood pressure. It is important that the tubing on the cuff is pointing downwards, as demonstrated before putting the cuff on. The cuff is placed up your arm, beyond your elbow, and the tube is placed so that it is at the front of your elbow, as shown. You will then be asked to push the button that says Start, Stop. It is important that you are not talking during this phase and that you are as relaxed as you can be with your arm. The blood pressure monitor takes 30 seconds or so to get a reading, and your clinician will either ask you to read this out or will be able to see this via a camera. At the end of the consultation, whether done by MedicSpot or via the clinician coming in to see you, you will be asked to replace your mask if it had been taken off during the consultation. You may be asked to wait whilst we are checking that there is nobody else in the waiting room, and when there is an appropriate time to ask you to leave, you will be asked to stand up and leave via the waiting area. Whilst walking through the waiting area, please remember to remain 2 meters away from any other person. You will exit via our main entrance. On leaving the building, you can keep the mask on and take it home and dispose of it appropriately. Please remember to maintain the 2 meter rule on exiting and returning to your car.